Hi, this is Sarah Baroni, and I'm going to go ahead and do a PICC line dressing change. So before we enter the patient's room, we're going to check the doctor's order and gather our supplies. And then we're going to knock on the door and then introduce ourselves. Hi, your name is Sarah. I'm going to be your RN today. I'm here because the doctor has ordered for a PICC line dressing change. Bring in all the supplies, then pull up the doctor's order on the chart in the computer in the room. And just double verify that this is the correct patient. So ask them for their name and their birthday. Also ask if they have any allergies before actually doing any type of procedure on them. Explain what you're going to be doing and answer any questions or concerns that the patient might have. And then before you go ahead and get started, provide privacy for the patient and ask them if they're able to turn their head away from the incision site. If not, we will provide a mask for them so they can wear that if they need to. So I'm going to go ahead and open all of my supplies, wash my hands, and then open all of my supplies and get everything organized. Then I'm going to put on my mask. Make sure it's nice and secure. And then we're going to go ahead and put on clean gloves for the first part of this assessment. It is going to be a clean procedure. So I will go ahead and put my gloves on. And then before we actually even take any of the old dressing off, we're going to assess this site because we want to make sure that there's no infection. We want to ask the patient if there's any tenderness. We want to check if there's any redness, any drainage coming from the outside of the line, and ask if they have any pain or any tenderness. Now the first thing we're going to do is take a tape measure, and we are going to go ahead and measure how much of the tube that we can see from the patient, because when we are going to take care of everything, we want to make sure that we have the same amount of tube and we haven't pushed it in or pulled it out during the procedure. So now that we have our measurement, we're going to go ahead and take off this clear tape, and noting that this was the last time that the patient had a dressing change. So we'll go ahead and start on the outside. And work our way towards the middle. Just making sure that we stabilize everything, because we don't want the line to come out of the patient. So once we're done with the outside, we'll work our way towards the middle. And just making sure that we don't tug too hard. Okay. So after we get this off, we're going to dispose of it properly per your hospital's protocol. Then we're going to take an alcohol pad, and we're going to go ahead and just go around here, around the stat lock, because we want to loosen up the stat lock and also clean on top of the stat lock, just to disinfect if there's any type of bacteria or germs that are around the stat lock before we remove it. So we'll go ahead and do the alcohol pad and dispose of this, and then we will gently lift each side from the patient's skin and then unlock the stat locks, and we will go ahead and peel off this stat lock and remove it, dispose of it in the proper disposal. And then we're going to tell the patient to stay very still, because at this time we have no stat lock to keep our line in place. At this time, we will take our gloves off, do hand washing procedures, and put on sterile gloves. So at this time, my gloves are sterile. Next, we're gonna take our chlorhexidine. We will crack it, and we're gonna use this to disinfect in a circular motion, carefully lifting the line in a circular motion outwards, underneath, in a circular motion. And then we will dispose of this. And then we will take one more chlorhexidine, crack it, and gently lift the line and disinfect. Now, each time we're disinfecting, we're gonna make sure that we're scrubbing for 15 seconds. That's how we're gonna make sure that everything has been disinfected. Dispose of this properly. Now we're gonna let the chlorhexidine sit for 30 seconds. It has to air dry. Nobody should be blowing on it or fanning it, because that just introduces new bacteria to the incision site and could cause a possible infection. So we want to let it air dry. Next, we're going to take our skin prep, open it, dispose of that, and then we are going to make a circle around the edges where the patient is going to have their transparent tape. This is going to allow the tape to stick easier so that the patient can have the tape on for about 3 to 7 days. Then we're going to go ahead and place a new stat lock on the patient, keeping in mind that the arrows need to go upwards. So we're going to go ahead and lock the lock in place, peel off the backside, and gently make sure that it is stuck to the patient's arm. Then we're going to take our transparent dressing and place it over the incision site, keeping in mind that the tubes need to go through this little hole here. We want to be able to see our dressing entirely. That way we can monitor for any signs or symptoms of an infection. Then we're going to take the date sticker. We're going to write our initials, the time, and the date that the dressing change was done, so that the next nurse knows when the dressing needs to be changed next. Before we take off our gloves, we are going to change the ends of the caps. So to do this, we're going to make sure that we remove this. We are going to take an alcohol pad, dispose of this properly, and do a wiping for 15 seconds at least. That way we know we got all of the germs out and all the bacteria. And then we will place a new cap on it. We want to make sure that the patient hasn't had any type of reactions or any pain during this procedure. And we are going to go ahead and dispose of all of our trash properly. It's according to the facility protocol. We are going to remove our gloves. We're going to wash our hands. I'm going to place my patient in the lowest position possible. Make sure that they are comfortable. Place the call light within reach. And I will document my whole procedure, including any reactions or any questions that my patient had at this time. And that concludes a PICC line dressing change.